Oh, yeah, it certainly was. This was some good political reality TV, Las Vegas style, earlier today on CNN. Mayor Carolyn Goodman going toe-to-toe with Anderson Cooper. The mayor going all in, calling for Nevada to reopen. Cooper wasn't having it.
Just let the businesses open. If it becomes a vector for viral infection and those people go back to their states and around the world, so be it.
It's a responsibility of each one of us as a human being and part of the civilized world to know when we're sick. We don't do bad things to people at all, ever.
And so it went this afternoon on CNN with Anderson Cooper. Las Vegas Mayor Carolyn Goodman continuing to try to make her case to reopen Southern Nevada, saying we've seen other horrible viruses in the world before, and they never led to a global shutdown.
We've had Ebola, we've had the West Nile, we've had polio, we've had these
none of those were as
painful.
infectious in Las Vegas. I mean, you didn't have people with Ebola on a casino floor. You know what? If you did,
we don't know that.
Anderson Cooper continued to push back.
This isn't China. This is Las Vegas, Nevada.
Wow. Okay, that's really ignorant. But you're encouraging, I mean, hundreds of thousands of people coming there in casinos, smoking, drinking, touching slot machines, breathing circulated air, and then returning home to states around America and countries around the world. Doesn't that sound like a virus petri dish? I mean, how is that safe?
What it sounds like? You're being an alarmist. I'm not.
County Commission Chair Marilyn Kirkpatrick points out the Las Vegas Strip is in Clark County jurisdiction. She says everyone is working overtime right now to reopen, but now is not the time.
I understand the frustration, but what I'll tell you is I'm not willing to risk the frustration to go backwards and have to start all over. Even if downtown got the go-ahead tomorrow, I'm not sure that they could fill the rooms because, you know, when I checked just yesterday, our airport, 97% of our flights are canceled.
Well, you're right in saying that everyone is talking about this interview. The fallout swift, the reaction just as fast and furious from the governor to council and commission members, even the culinary union and Representative Dina Titus.
I think that the mayor needs to listen to the scientists and the health care specialists and stop talking about my constituents as though they're guinea pigs in some grand experiment that she's trying to conduct.
Nevada Representative Dina Titus sounding off tonight like many others following this exchange on CNN.
But you're encouraging, I mean, hundreds of thousands of people coming there in casinos, smoking, drinking, touching slot machines, breathing circulated air, and then returning home to states around America and countries around the world. Doesn't that sound like a virus petri dish? I mean, how is that safe?
What it sounds like? You're being an alarmist. I'm not. I've lived a long life. I grew up in the heart of Manhattan. I know what it's like to be with subways and on buses and crammed into elevators.
Mayor Carolyn Goodman encouraging the reopening of casinos on the Strip.
Just let the businesses open. If it becomes a vector for viral infection and those people go back to their states and around the world, so be it.
It's a responsibility of each one of us as a human being and part of the civilized world to know when we're sick. We don't do bad things to people at all, ever.
Governor Steve Sisolak responding to the mayor's comments in an interview with Anderson Cooper this evening.
But when we do it, we're going to do it right. But I am not going to allow our workers to be put in a position that they have to decide between their job and their paycheck and their life. That's not a fair position to put them in.
City Councilman Brian Knutson agrees with Governor Sisolak that they should follow a reopening plan done in phases when the time is right.
We're still in the midst of a health crisis, and we need to preserve and protect the health and safety of our residents, first and foremost.
The culinary union that has lost 11 members to the virus, calling the mayor's remarks outrageous. Their statement reads, quote, "We want people back to work, but it has to be safe and secure, and we don't want workers to be part of the experiment."
If we opened up too soon and we have problems with either our employees or tourists, that word's going to go out and it's going to kill Las Vegas. Until we know that we're able to test people, there's just no way to do it. And that's coming.
Clark County Commissioner Tick Sagerbloom also reacting to Mayor Goodman's comments, saying opening casino doors too soon could have a major negative effect.
A few of the takeaways. One, his experts tell him there isn't any kind of downward trajectory in cases yet, so it'll be the virus and science, according to the governor, that will determine the future date for when Nevada can reopen. In the meantime, he says keep up with the social distancing. Reopening Nevada will take time, and Governor Steve Sisolak says we're still a ways away from it, and he can't pinpoint a date yet.
I know people are anxious. I know people want a date. I would like nothing better than to give you a date. But what I have to look for, I'm not determining when this date is going to be. The virus and the science is determining when the date is going to be.
Do you anticipate extending your stay-at-home order that was originally going to expire on April 30th?
Yeah, I can't even go to that extent yet. That's 9 days from now. I mean, I don't know if we're going to see a trajectory by 9 days from now.
The downward trajectory in COVID-19 cases he's referring to is in line with guidelines coming from the White House. The governor says in order to begin reopening Nevada, he and his medical experts need to see the cases and hospitalizations consistently decrease for 14 days. And are your experts telling you we're just not there yet?
My experts are telling me that we've reached a plateau. They think that, we're kind of moving along. It goes up a little bit, down a little bit, up a little, down a little bit. We're moving in a plateau level. We have not started that trajectory downward where you're seeing a reduction in the number of hospitalizations on a steady, not just one day, on a steady basis. And you're not going to know that you're on the way until you're a certain amount of time into it. So you see, it's just not an anomaly that you've had a 1 or 2 day dip.
I asked the governor if he had a response to Las Vegas Mayor Carolyn Goodman's comments about reopening. Put simply, the governor said he and the mayor disagree, and Las Vegas will become Las Vegas again eventually.
It's a great place to come and enjoy yourself and have a great weekend, just not today. Today's not the day, but when the day comes, we're going to welcome everybody back with open arms, and Las Vegas will continue to be one of the safest places in the world to come and visit.
Yeah, they certainly are, Jim and Reed. Some good news for you at this 6 p.m. hour. So Southern Hills Hospital says on Tuesday afternoon they gave their first transfusion using plasma, and they said this is one of many that they hope to do in the future. And they say this could be groundbreaking in helping so many patients who are recovering from COVID-19.
If this works, this would be huge. This could be a game changer.
It's another possible weapon in the arsenal against COVID-19, one some doctors believe could also help patients in their struggle to recover from the virus.
If you can give someone a boost of these antibodies rather than wait for them to make them on their own.
Dr. Hank Hanna, a regional medical director with the Red Cross, says it's called a convalescent plasma transfusion. Blood of recovered COVID-19 patients carries antibodies that successfully fight the active virus. That could help transfused patients sick with COVID-19 recover faster. And while it's not scientifically proven that this treatment works for coronavirus, doctors say it's a treatment that has worked successfully for some in the past.
We're excited, but we're also cautiously optimistic.
Dr. Dominic Marantello is the chief medical officer with the Southern Hills Hospital in the Southwest Valley. He says the idea isn't new to science. Plasma transfusions to treat viruses date back to the 1800s.
This is one that we've seen work in the past, so obviously we're much more hopeful.
That's why Tuesday afternoon, Southern Hills was one of the first hospitals in the state to perform a plasma transfusion on a COVID-19 patient. And while it'll take a few days to learn the results, the hospital says they're encouraged by what they've witnessed so far, and they hope to do more soon. Dr. Marantello says compared to other possible coronavirus treatments, plasma transfusions are relatively lower risk.
Instead of having, a drug that's going to poison other biological machinery, this only has one purpose. The antibodies go in and they bind up virus and they destroy it directly.
It's potentially a large number of lives saved.
Dr. Hanna says doctors hope this weapon may be the tool they need in the ongoing battle with COVID-19 until we get a vaccine.
So right now, this is, I think, the best thing, the most promising thing out there.